In this video we're going to talk about the causes of back pain and why does it hurt. How is your mind and body involved? What are the 5 key things to consider? And where's a good starting point for treating and overcoming back pain? Hi guys, Carl Green here, Fitness for Life Physio, and I've been empowering people to overcome their pain and health and fitness problems since 2002. Please like and share this post with others and take a look at the links in the description to learn more, and also don't forget to subscribe so you don't miss any future posts. Now, back pain is a really big topic and a really common problem, so I've made this video, the full video, slightly longer than normal so that I can give you lots of information all in the same place. So stay tuned and I hope you find it really useful. Okay, so back pain can be described in lots and lots of different ways by lots of people. Generally, people will talk about aching or sharp pains, stabbing pains. Sometimes people mention stiffness and tightness, or even weakness in the mid-back or thoracic spine, which is sort of the upper part, the sort of forward curve of the back here between the shoulder blades, or in the lower back or the lumbar spine, this inward curve in the lower area there. And that pain can also spread and refer to other places. It's not uncommon to get achy pain in the thighs or into the buttocks as well. Really common with back pain. So triggers for irritating your back pain can really vary. Some people talk about sitting being something that aggravates them, or just being still for too long. Other people talk about getting pain when they're exercising, when they're doing weightlifting, or things like body weight exercises like lunges, etc. Other people can get pain doing other forms of exercise, core exercises, and things that you see in Pilates classes and yoga and things, holding positions like planks like this, or balance and mobility exercise as well. And then there's a lot of people as well that just get pain doing the day-to-day things, you know, hoovering, washing, cleaning, housework stuff, and also those self-employed or employed with manual work or sedentary work, office work and desk-based work, that sort of thing. Now, pain can lead to reduced physical activity, and that can increase the risk of becoming unfit, having low moods, depression, anxiety, and that gets worse the longer it goes on and makes recovery more difficult. It's a vicious cycle sometimes, but it doesn't have to be that way. Now, I've treated hundreds, if not thousands, of people with back pain over the years in different roles, sometimes one-to-one, sometimes in group sessions, in both the NHS and privately as well, in occupational health settings, or in specialist chronic pain services as well. And personally, I've also suffered and overcome chronic pain, so I have a really good understanding of it, both as a professional and as a previous patient as well, an expert patient as such. So if you want to find out more about me and my sort of history and my story and my background and things, please take a look at my About Me page on my website as well. Now, over the years, people have asked me lots and lots of questions about back pain. So I wrote a long list and it took a long time to read through them all. So I've cut it down to some of the real key ones. I'm just going to read them off the screen here for you. So, common things I hear: well, I didn't have an injury, so why does it hurt? Why hasn't it gone away? Is it because I've put on weight or body fat? Is it because I sit or exercise too much or not enough? Is it due to stress? What about posture? Do I need to be realigned or manipulated? Is it just part of manual or office work? Do I need stronger painkillers? What specific part of my back is the true cause of the problem? Which muscles, bones, joints, discs, nerves? What's affected? Now, as I'm sure you can appreciate, as I've already said, back pain is a huge topic. So to cover all of these questions and all the others that I had written down would just take hours, and it wouldn't be specific enough to your situation to really help anyway. So what I've done is I've had a good think about it, and I've come up with 5 main things that I want you to consider, and I hope you find them really useful and help just clear up some of the thoughts around back pain to help you make a great start in going forward. Okay, so number 1, back pain can come in many forms and be very confusing or worrying. Okay, so there are lots of diagnostic terms and labels, causes of back pain, and if you rely on untrained eye, an inexperienced or money-focused professional, or a Dr. Google, you can easily be misled and become anxious about having something more serious. Now, sadly, I see this every week, all the time, for years, and it needs to change. We need to be giving people the right information. So here I am trying to do that. So it can cost people loads of money unnecessarily, can also waste their time, and just delay their recovery as well. So I'm really passionate about trying to help people with this. I don't want this to happen to you. So yeah, please get in touch if you think you've fallen into this trap, and I'll help try and get you out. Okay. Number 2, how do we diagnose the cause of your back pain? So forming an accurate diagnosis takes much more than asking someone where their pain is, looking at their posture, feeling your back, or taking x-rays and MRI scans. So myself and other professionals should have several potential causes on our minds when we're talking to you, and we'll ask lots and lots of questions about your symptoms, your body, your thoughts and feelings, your medical history and your lifestyle, in order to put all these clues together and come up with what we feel is the most likely cause of your problem. We'll also do some screening for other potential problems that you may not have thought of as well, and ask you other questions that might not seem relevant, but to us, we're trying to pick away at some of these potential reasons why you've got your pain. We'll then complete a physical assessment, looking at the way that you respond to different movements and different physical stimulus, and see your reactions. And then we need to see, does that match the types of things that we're thinking of based on your history and your individual situation. So number 3, what conditions can cause back pain? But before we go into the list of those things, just want to clear up one thing that people do often sometimes get confused or misled about, and that's sciatica. Sciatica is different to back pain. You can have both at the same time, but they are different conditions. So there are lots of health conditions that can cause back pain, and actually the more you learn and experience, the more you realise that there's even more options out there of things that could be causing it. Now, I'm going to talk through each one in terms of systems of the body. So the first system would be the inflammatory, inflammatory causes of back pain. And the most common that I come across is ankylosing spondylitis. And if we look onto another system in the body, so the neurological system, it's quite common to get back pain with conditions like Parkinson's or after a stroke as well, because of the way that those things can affect our movement. Other types of problems can be more joint related, so conditions like spondylolisthesis, and there might be changes to vertebral discs, and you hear a lot about slipped and bulging and prolapsed discs being a cause of back pain, which can be the case but not always. Also osteoarthritis and things like hypermobility as well. Now we can also suffer injuries and traumas, and that might cause things like fractures or muscle tears or cartilage tears, sprains, strains, dislocations, these sorts of things. Or we might have more repetitive tissue stress problems, things like tendinopathies. And if you've had more persistent or chronic pain, so pain lasting longer than sort of 3 months, 2-3 months plus, then there can also be other things influencing your pain, and we call this central sensitisation, which is a massive topic on its own. And you may also be experiencing what we call referred pain, and that can be coming from the organs inside the body, or very, very rarely something more serious or sinister. Okay, so number 4, we are living things, living human beings, we're not machinery. So it's not as simple as saying what structure isn't working. Okay, our bodies and our minds are involved in pain, and they have to adapt and respond to what we do with them, to the environment and any changes that are occurring, and they also can become affected in lots of different ways from injuries or illnesses. Okay, so number 5, how have you been thinking or behaving? And are you providing the right level of physical and psychological stress and stimulation to adapt effectively? Do you regularly do things that keep your mind and your body healthy and fit enough to be able to cope with life's physical and emotional demands? Do you develop and maintain bodily sensations and your perceptions? And I've done a separate post explaining what those things mean. And do you challenge and manage your self-talk and your emotions to try and focus on the things that are really in your control and that you can do differently to try and help yourself? So to summarise this video about causes of back pain, the main take-home messages are it's not easy to figure out the causes of back pain. There are lots and lots of different scenarios, things involved, potential diagnosis and potential influences in your life that could be contributing to your pain, which is very individualised. Even with all the knowledge of all the extra conditions, it's very, very difficult for you, ourselves, to figure it out, which is why we need professional help, really. It's very easy to get confused and get misled when trying to find answers and treatment. If you have back pain and you want to help yourself get better, then please consider a few sessions with me, someone you can trust that's appropriately qualified and experienced. We'll assess the bigger picture and the finer details for your situation. Have a look at my other services as well, some of those might be interesting for you. Also the blog, subscribing to that for some free information as well like this. And I'd hope to support you in finding an empowering way to keep you fit and healthy and enjoying life and in less pain. So I'd encourage you to have a think about your situation. What things are you doing that could be placing stress or stimulating things in a good or a negative way, and how might they be affecting you at the moment? If you'd like further help, please get in touch. Like I've said, all the links are in the description as well, or have a look around my website. More than happy to help you. Like I say, big interest of mine this, so please do get in touch, even if it's just to quickly check in and ask me a question or something. I'm more than happy to help, and hope to help more of you soon. Thanks a lot.